Welcome to today's update. Now, mostly looking at the United Kingdom this morning. Quite a few things going on, but again, this always shows us principles that apply to the whole world. Now, what we're seeing is a resurgence of cases in Europe, a definite increase in cases in Europe at the moment. But before we get to that, let's just look at a little bit of context. These are the increasing cases globally in the world. And of course, these numbers keep going up, but the point is they're going up more steeply at the moment than they have been, which is a problem. It's increasing. Now, just before we get on to the regional information, let's have a little bit of science, just a little bit. Scientific advisory group for emergencies that works for the UK government. Singing may be as risky as coughing. Interesting. Especially gatherings of large numbers for a prolonged duration. Evidence of more aerosols than normal talking or breathing. So singing in a confined space is a particular risk. It's about the same as coughing, maybe as risky as coughing, because of increased aerosolization. Now, the aerosolization refers to the very small water droplets that can hang in the air for a long period of time, for hours, and they have the virus within them and can transmit the virus within them. This aerosolization spread. Even in outdoor settings, the wind can keep droplets airborne. Now, they don't say for how long, but singing or coughing outside, therefore, does constitute an element of risk. Now, the risk inside is way greater, and the poorer the ventilation, of course, the greater the risk is going to be. Now, to put the UK into context briefly, new cases in Europe. Spain have got the fastest increasing rate, then Spain, then France. This is regardless of population, this is just in total numbers. Germany is increasing but at a lower rate. UK is increasing but at a lower rate. So Spain and France are increasing more rapidly. And although the numbers are lower overall in these countries, Poland, Belgium, Italy, Switzerland, Denmark and Greece also have increasing numbers. So this is what we're looking at now, a resurgence of cases in Europe. And this is causing quite a lot of alarm all round about Europe because of the peaks that we had back in April. And governments around Europe are responding to this in different ways which I hope are going to be really quite effective. But because I know the UK better, let's look at this example. Now, the reopening on the UK was on the 4th of July. That's when our lockdowns kind of lifted big time, fairly big time. But of course, with these things, there's a big lag effect. So from when you carry out an intervention to when you see the effects, there's several weeks or a month or sometimes more lag. And this is the same if you impose a restriction, it takes a few weeks or a month or two to come through. And it's the same when you ease restrictions, there's a lag. And I think this was a big problem in the United States, because in the United States, the lockdowns we can now see were lifted far too early in many states because the numbers seemed to be low. And then they didn't seem to increase in the first week or two. Well, no, they don't. They take time. There's this lag effect. We've used this oil tanker analogy that can keep going with its own momentum for long periods of time. So we're now seeing the results in Europe, as we predicted, as was fairly obvious really, of the lifting of the lockdowns. And the prevalence of the virus in the community is now increasing in the UK. There is an increasing number of people carrying the virus and infected in the UK. Now let me give you the evidence for that. It comes from the Office for National Statistics. And it's based on their random household antigen testing. So they test a certain number of people every week. It excludes care homes. And they've estimated in the country the new number of daily cases is up from 3,200 last week. And now we're getting 4,200 new cases this week. So sorry, I haven't explained that very well. So last week there was 3,200 new cases per day. This week there's 4,200 new cases per day. And the numbers have gone up by 1,000 new cases per day over the course of 1 week. So quite dramatic. Now, these are higher than the figures from the Department of Health because these are random and they're testing people that are symptomatic and asymptomatic, whereas the Department of Health are only giving the figures for people that turn up because they feel they're asymptomatic. So in the country, it's actually 1 in about 1,450 of us are now infected. About 1 in 1,500. 15th of July it was 1 in 1,800. 2nd of July it was 1 in 2,000. So we see quite a dramatic increase, and the number's actually lower than that. It's probably about 1,450 now. So we are seeing this increase, and that is based on very sound evidence from the Office for National Statistics. And my COVID symptom tracker app is actually in agreement with this. It's showing just over 4,000 new infections per day in the UK. And of course, without mitigation, that will result in the renewal of exponential growth. Exponential growth, where the acceleration in growth rates itself accelerates, which of course is what we don't want. In other words, this virus could become out of control in the UK and in Europe if we don't take the appropriate measures. That is the risk that we're up against. Out of control exponential growth that will go on rapidly infecting 70% of the population. That risk is still there because only 5 or 6% of the population has so far been infected. That means that still over 90%, well over 90% of the population is still vulnerable to infection with this novel virus. Now, Chris Whitty, Chief Medical Officer, says the UK is as open as it can be. So basically he said we've opened up as much as we can. Open up any more, we're going to start getting a lot more exponential growth again. He said we're at the outer edge of what is possible in opening up society. The idea that we can open everything up and keep the virus under control is clearly wrong. So basically, Chris Whitty is saying we are as open as we can be. We can't carry on this process of opening up without having renewed exponential growth of the virus. Now, excellent news. Face masks are to be mandated in museums, galleries, cinemas and places of worship. So very pleased to hear that. Of course, places of worship are very limited in the numbers, and that's not always adhered to, of course, but they're supposed to be. Certainly, my church hasn't met as a church since the start of the lockdown in March, and it's the same for all the churches I know of locally. Now, Boris Johnson has got a new saying: "Hands, face, space." Like it, hands, face, space, fairly self-explanatory, and get a test. That bit doesn't rhyme, of course. I'm sure he's working on it. But hands, face, space, get a test. So it's great. He's saying we need to press the brake pedal. We can't go on reopening. Indoor performances, children going back to school is a national priority. And there's trade-offs. So indoor performances don't look like they're going to happen at the moment. But they want children to go back to school. But there's trade-offs. And we'll look at what that means in a minute. Basically, it means if you open up one sector of society, you have to balance that off with other members of other aspects of society. So what it's saying is, like, if you open pubs, that will increase the R value by a certain amount, and if you open schools, that will increase the R value by some more. But there again, if you open schools without opening pubs, that will keep the R value down. So it's kind of a trade-off in where the transmission takes place. So it's getting quite complicated, really, but that's what they're talking about, trade-offs. I don't want to see that just now, that comes later. Now, we'd hope to reopen casinos, bowling alleys, ice rinks and beauticians. Now, they're all postponed to the 15th of August at the earliest. So casinos, bowling alleys, ice rinks and beauticians, all still closed. I have been bowling, that's good fun. I have been to ice rinks a long time back. The other two don't bother me too much, but all parts of the economy, of course. Now, Professor Graham Medley, this is what he's talking about, SAGE. This idea of trade-offs. England could consider closing pubs in order to reopen schools. So close pubs, reopen schools. Probably get the same total level of spread in the country. And so actually closing some of the other networks, some of the other activities may well be required to enable schools to open up again. So close some things down, reduce spread there, open schools. Opening schools will cause more spread, but it's balanced off. We can keep it at a manageable level. It might come down to a question of which do you trade off against each other? And that's a matter of prioritising. Do we think pubs are more important than schools? Come on, Professor Graham, that's a bit of a loaded question, isn't it? Anyway, we'll let him off with that. Rising coronavirus infections appears to be among young people. Interesting. So, main rise amongst young people. So, this is what you need to do. You need to look at where the drivers of transmission are. What sectors of society are driving transmission? And young people seem to be part of the problem, largely because of socialising and drinking in pubs, which of course is perfectly understandable. But that's driving infection. So it may be that closing pubs down has a big difference. It may be not. It depends on to what degree that is the driver of transmission. But certainly throughout Europe and in the United States, young people socialising has been a driver of transmission. Now, fortunately, they don't get severe disease usually. They can do, but not usually. But of course, they transmit it to the rest of us who aren't quite as young anymore. Rising coronavirus infections appears to be among young people. One, that there was a danger it could spill over into other parts of the population. Spill over. Now, we have talked about this quite a few times on this video. The idea that the curtailing of the pandemic is as strong as the weakest link. So if particular religious groupings or particular social activities or particular work activities or particular relaxation activities like young people drinking in bars, that they can be the main drivers of infection. But if one sector is not behaving itself, then that can spill over into the rest of us. So in a sense, a country is as strong as its weakest link. And we've seen this in the United States. The vast majority of people obeying the rules, socially distancing, but small groups going to protests, drinking in bars, going to parties. Small groups kind of ruining it for everyone else. Because the price that we pay, the price that many of us are paying to keep this R value down is high. I mean, I don't want to over-personalise this, but my father's in hospital at the moment. I can't visit him. That is a high price. It's a high price to pay. And yet some people are going to religious services, drinking in bars, going to parties, and undoing the price that I am personally currently paying. And it's just not fair. Everyone needs to pull together. Yep. Northwest lockdowns, highly unlikely to be the last intervention that has to be done regionally. So this is Professor Graham Medley from the Scientific Advisory Group, SAGE, Scientific Advisory Group for Emergencies. Now that last bit, what he's saying there is we have this sort of smart lockdown. We had Leicester, now we've got areas of the northwest, Manchester, Oldham, Lancashire, parts of Yorkshire closed down because of the rising cases in those areas. So rather than locking everywhere down, we just lock these particular areas, these particular hotspots down, and that hopefully suppresses the transmission in that area. Because if we didn't do that, the infection would spread from that area out to the rest of the country. So this sort of smart rolling regional lockdown strategy makes a lot of sense to me, actually. It's the most economical way to do it. So Leicester, for example, been partly locked down for about a month now. No meetings or in homes or gardens. Cafes and pubs opening from Monday, but they have been closed for about a month. The numbers are falling. It is working with this lag effect. And they are also blitzing the place with testing. So they're doing 12 times more testing in Leicester than they are in the rest of the UK because it's a hotspot. So that's good because it means you can identify the people with the virus, instruct them to isolate their contacts, and thereby we can contain the spread. The testing is what makes the invisible virus visible. So that's what the health authorities have been doing. Extensive testing in Leicester to flush out infections, to make them visible. So that makes a lot of sense to me. Focusing testing on these temporarily regionally locked down areas. Now, the lockdown in Manchester, Bolton, sorry, where are we? There we go. Manchester, Bolton, Bradford. It's a contiguous area in the north of England. South of me, but most people call it the north of England. And it's affecting these regional areas, have this increased level of shutdown. 4.5 million people for at least a week under restriction. Pubs and restaurants are still open. Fortunately, this time of year, quite a lot of pub drinking is outdoors, which of course is safer. But no meetings in households or gardens. So no meetings. So what it's saying is that one household may not visit another household. And this is a particular problem in the Asian community because it's one of the celebrations. Apparently, I've only just learned this, but there's 2 Eids in the Islamic calendar, and this is one of them this weekend. But what happens is one household or several households go into another household. So you'd have several households mixing in one area. And basically, if there's any infection there, the transmission is guaranteed. And especially in that culture, there's a lot of tactility within a single sex as well, a lot of hugging, handshaking, things like that. So that would be guaranteed spread. So it does make sense to me that this would be curtailed. Now, unfortunate for the people that are involved, but everyone else is paying this price. Everyone has to. I couldn't go to church on Easter Sunday this year. Other people around the world couldn't go to church on Easter Sunday. Religious activity does need to be curtailed on a collective basis. Pray at home, of course. You don't need to do these things. So many churches and mosques, and I don't know about mosques actually, I suppose they are, but so many churches are online. Now, the spread has been a particular problem in these areas in the Asian community. Again, we're looking at these drivers of infection. So the population of Blackburn and Darwin, for example, 30% Asian, 25% Muslim, therefore would be highly affected by the Eid celebrations had they been allowed to go ahead. So in this area, 114 new cases in the last 2 weeks, but 97 of those Asian. So we can see there that, 90% of the cases have been amongst Asians, but they only represent 30% of the population. So behaviour patterns in Asians in that area have allowed the virus to spread within that community. That's why it needs to be shut down. Because remember, we are as strong as our weakest link, and they would spread the virus to other communities and other parts of the country. Now, this is not out of the blue. Blackburn health authorities last Tuesday introduced new measures and warned that further measures may be necessary. Reducing household visiting to one household plus 2 members from another household. A bit complicated, but there you go. Face coverings in all public spaces, good. Inspections on all corner shops to make sure they're obeying the rules. Bans on hugging and handshaking, and increased testing. So this was introduced last Tuesday. So it was clear that the cases were increasing in these areas. Now, other factors, as well as Asian community transmission, there's been some illegal raves. Now, I've never been to a rave. I think I've missed out on that. But these are basically parties out in somewhere or other. But a lot of young people together, so that's bad. Young people have been the drivers in these. There's been a lot of football-related celebrations, and people ignoring that in the euphoria of their whatever form of euphoria that seems to induce. Pubs have been a driver, and to some extent beaches. I suspect not so much the beaches themselves, but the toilets and things associated with the beaches. But remember, we're as strong as our weakest link. So this mosque leader here, Mr. Mohammed, I can't pronounce the rest, sir, do apologise. But he's agreeing. Sadly, there has been people within our community who are not taking coronavirus seriously enough. Everyone has to do this together. We are as strong as our weakest link. He goes on to say, since the easing of the main lockdown, a lot of people have been visiting relatives and friends and attending events in each other's homes. This is the key thing. Mixing of households with very little thought of keeping themselves safe. So that's this gentleman who's a community leader. And there's been particular problems, I think. Well, let's see what he says. We've been trying to get them to understand the measures and take greater precautions, but what can we do? Now in Bradford, we find ourselves in a very dangerous situation with coronavirus cases on the rise. So these public health measures have unfortunately been necessary. And another local community leader, one of our big problems, we have had a lot of people going to pay their respects at the homes of those who have recently died. Now, the tragedy is, and I've been going on and on and on about this for months, Asians and black people, Afro-Caribbean extraction people, are much more at risk of severe morbidity and death. They should be taking, well, everyone should be taking the same precautions, but they're at much greater risk. But these community leaders are saying that the precautions in these areas have simply not been taken, which quite frankly is unacceptable. But as a result of that, people have been dying. And as a result of that, people have been going to funerals. Now, these funerals, of course, are a very cultural thing. We lost a member of our congregation 2 weeks ago, and there were 50 people gathered at his house to express their sympathies from this particular mosque. Now, of course, you know, when people die, you want to come together, but we're in a pandemic, we can't. Now, this was a problem. I can't remember where it was now, but there was a Republican political leader in Northern Ireland, I think it was, went to a funeral. I can't remember her name now. I think she was like the deputy leader of something. And she just completely ignored the social distancing regulations going to this funeral. Now, of course, it's the most human thing in the world to pay your respects. But the law is there to protect us all. And unfortunately, we cannot have the normal funeral rights that we would like at the moment. So that has been a particular problem as well. And of course, from the beginning of this, I've always said, and I've said this for a long, long time now, we must not let cultural aspects get in the way of the infection control program. That applies to my culture, to your culture, to everyone's culture. And there are ways we can work around this. We have videos, we have Skypes, we can work around this. That's what we need to be doing. Single road in Bradford registered 17 coronavirus cases within 6 days. And of course, we looked at that case before, where there was great disproportionate number of Asian transmissions within the Asian community. So definite challenge for people in the Asian community. Hopefully lots of them are watching these videos and will get a few tips and obey the guidelines and log on to all the government websites and find out what you're supposed to be doing. It's not that simple. It's not hard, really. I mean, we just have to do it. It's hand hygiene, social distancing, mask wearing. We know these things. Good ventilation, outdoor activities where possible, not household mixing. All these things are well known now. Now, Professor Dominic Harrison, the local authority's Director of Public Health, in this, I can't remember quite where actually, is one of the places in this Manchester area. Driver of infection. So why has there been so many infections? What's driving it? Single cases are leading to household spread, particularly in multi-generational households. Now, I was on an interview with German TV that you might have seen yesterday, and the chap there was saying that Asians don't live in multi-generational households. Now this is a problem, because when you say things that simply aren't true, it means that all your reasoning is no longer based on facts. It's just in your own head. You just make it up as you go along. It's not based on real life situations. Because let me give you the evidence from the Office for National Statistics. Now, I'm not saying this is good. I'm not saying it's bad. I'm not saying it's brilliant. I'm not saying it's appalling. It's simply a fact. And if you watched that video yesterday, this guy was denied. He just contradicted the facts 2 or 3 times, and wouldn't accept any evidence. It's not a good place. We need to be on the facts. So this is from the Office for National Statistics. Downloaded from the website yesterday. So Bangladeshis. So contains somebody aged 0 to 19, 20 to 69, and someone aged over 70. In other words, a 3-generational household. And in the Bangladeshi community, we see that's 56% of households. In the Pakistani community, that's 35% of households. In the white community, it's, I don't know, what, 1%, 2%, something like that. So the evidence there is clear. That's not good, it's not bad, it's not anything, it's just a simple fact. And to deny that is like saying Australia doesn't exist or the earth is flat. It's just, to deny facts is nonsense. We have to be evidence-based. And if individuals claiming to represent communities are denying simple facts, then to me that's a problem. Now, so what Professor Harrison is saying is it's not so much an outbreak as a general rising tide. The kind of level is increasing, more community transmissions. But he does say clusters of household infections are mainly South Asian areas. Mostly South Asian areas have been the problem in this contiguous area of the northwest, which is now closed or partly closed down. So, yeah, that's what the people are saying. And we know this is the case. So it goes from individual case. So what's, in other words, what's been happening? As far as I can see, what Professor Harrison is saying has been individual cases. That happens. They go home to a household, but it's a 3-generation household, so the older people are affected disproportionately. Another reason why more, as well as the lack of vitamin D, why more people from Asian communities have tragically, terribly died. Got really sick and died. So you're going from individual cases to clusters. But the problem was, if the Eid celebrations had gone ahead, that would have gone from household to household and the clusters would have turned into community spread. That's why this has been important. It's not attacking any community any more than it was when I couldn't go to church at Easter time. At risk, so areas that may need to be closed down shortly. Eden in Cumbria, that's near me. Very rural area, but rising cases. No idea why. I have to try and find out why. It's a fairly rural area, largely agricultural, and yet it's at risk of getting a lockdown because the increases are increasing. Sandwell in the West Midlands, Northampton, Peterborough, Rotherham, South Yorkshire, Wakefield, West Yorkshire. So these areas also at risk of future rolling smart shutdowns. Right, let's have a look at some pictures of you great people that make this worthwhile. There we go. So this is Anna and Nancy going for a walk, Ruby Falls, near Helen Gorge, USA. And they've been watching the videos, I think, since the start, so that is well worth a mention. Thank you for that. Excellent protection, and you're in the outdoors as well, of course, which is good. This is Charlotte. Let's have a zoom in. I can't see you, Charlotte. There we go, that's better. Now, glad to see Charlotte has got her hair tucked out the way, because hair did transmit infections in China. Glad to see Charlotte has got glasses on to protect her eyes, and glad to see that she's wearing appropriate face covering, all in good practice for going out. And Charlotte is in CT, which, I do hope I'm right. Is that Connecticut? Anyway, it's the United States. I think it's Connecticut. So thanks for that, Charlotte. Excellent example to us all. This is Francesca in Quebec in Canada. And without comment, we'll just see that she has very good taste in pens. Actually, I've been using the blue one today. I've still got this red one then. Right. So thank you, Francesca from Quebec. And notice that she's taking notes. Excellent. Thank you for that. This is Joanne, who's married to Bruce in Wisconsin. Now, Joanne is my favourite lady at the moment because I'm going to show you some. Now, Joanne, thank you, Bruce, thank you so much. This is not for this video really, but it's another interest of mine. And it is, you've sent me these arrowheads. Now, these arrowheads are made by Americans thousands of years ago. So, Americans that lived in Wisconsin thousands of years ago in the Stone Age. Are we keeping focus? Not quite. Let's go out a bit. So these are Stone Age arrowheads, thousands of years old. And Joanne knew I had interest in anthropology and people and things like that. So she sent me these that they picked up. I think her father-in-law picked them up from their land in the 1930s or something. So it really is a beautiful thing to send me, and I'm really grateful for that. And I'm going to do some more work on it and try and get them sussed out. So just to think these were made by people in Wisconsin all those thousands of years ago, artifacts from the Stone Age. So very, very moving present from Joanna. Thank you very much. And I'm going to do some research on that. I'm going to talk about it again. It's just fascinating, the sort of anthropology, the way that there's been people living on the land where you now live for all these thousands of years. Who knows how long? 16,000 years in the States, maybe. The area that's now the United States. Maybe even longer. Some new research shows 30,000 years. So very, very interesting. And I am very grateful for you sending me that. Also great to see you're wearing face masks, taking vitamin D, keeping your hands clean, and watching the videos. There we go. You can just see me there. So more on that. Thank you, Joanne. Took a while to come. I think they actually came via Tokyo or something. But anyway, absolutely brilliant. Thank you. Fascinating. This is Mark in Ottawa. So glad to see you're watching up in Canada, Mark. Thank you for that. Masks, glasses, hat. Excellent. Bear skin for some vitamin D. So much to learn from Mark in Ottawa. Good. Now I think Mark took this as well. Mask required for everyone's protection. Thank you for helping to keep everyone safe. Let's say it one more time. It's everyone's job to keep everyone else safe. Any more pictures? Oh yeah. That's this is Matthias in Austria. Can't I see you, Matthias? There we go. I think Matthias did say he was listening to me on podcasts, so quite acceptable. Quite acceptable. Thank you for that, Matthias. And this is Mrs. Davis in Australia. Now, Mrs. Davis was watching one of my videos, I am assured, on her phone, but caught in the act, Mrs. Davis, of watching me on a video. And I believe you're feeling a bit better now, which I'm delighted to hear. And this is Tim, who's in Darlington in the UK. Darlington's kind of northeast, isn't it? So Pretty cool mask, Tim. Thank you for that.